afternoon. I think it's afternoon wherever we are now. So good afternoon and welcome to the workshop. This workshop's being brought to you by the Pandora ID Net, which is a partnership between European institutions and African research institutions, supported by the European Commission through their EDCTP funding mechanism, European Developing Countries Clinical Trials Partnership. Our other partners on the program on this workshop are Africa CDC, which we're always grateful to partner with and who we have a long-standing relationship with. Primarily the events being organized by Chatham House, which is a think tank based in the UK. It's formally called the Royal Institute for International Affairs, and the Global Health Network, which is hosted out of Oxford University. So my name is Osman Dar. I'm the director of the One Health program at Chatham House. And I'm really delighted to be joined today for some opening remarks by Dr. Mohammed Abdulaziz, who is Dr. Mohammed I've known for a number of years. Great chap. He's the head of the Division of Disease Control and Prevention and acting head of the Division of Surveillance and Disease Intelligence at Africa CDC. Super guy. We've known each other a number of years now, worked together quite a bit over those years. He's also a leadership fellow at the Africa CDC Leadership Foundation, as well as being a fellow with us at Chatham House. So it's really great to have him. He'll give us a few opening remarks. Just as a bit of housekeeping first, though, again, as with the session yesterday, we're going to have a 3-hour session. Teaching is going to be a combination of short presentations, Q&A. So some of the Q&A sessions will be a bit longer, hopefully today, and we'll then have a case study session again to wrap up the workshop. So what are the main points I need to go over? Yeah, firstly, live interpretation will be available as we had yesterday. So use the language button at the bottom of your screen. If you'd like to hear the event in English, make sure you select English. Likewise, if you want to hear the event in French, then click French. In case you hear both the original audio and the interpreter at the same time, then just use the mute original audio option. Secondly, this session is being recorded. The recording will be shared in the coming days on the Global Health Network Africa CDC platform. So you can review the materials there and share them there and see all the presentations as well. In case there's slides you want to see afterwards. These materials can be found using the link that's being shared in the chat box now, hopefully. So whoever needs to share that in the chat box, please do so. To interact with the panel, please use the Q&A and chat function. There's 2 buttons there, which you can find in your toolbar. If you have any technical issues, please let us know in the chat, and the Global Health Network team is there and they'll assist you. So we have dedicated time allocated for the Q&A, as I said. So we'll try to get through as many questions as possible, and we've tried to stretch those sessions out a little bit today. Now, the other important bit, because this is quite a valued thing, to be eligible for the certificate of attendance, you must attend at least 80% of the workshop and also complete the workshop evaluation. The evaluation form will be sent to you via email after the event, and then your certificate will be automatically emailed to you once you have met these requirements. It's usually issued within 1 month of the workshop. So without further ado, I just want to thank again Dr. Mohammed Abdulaziz for coming and joining us. He's a very busy man, very important man, and hopefully he can give us a few words to inspire us at the beginning of today's session. So over to you, Dr. Mohammed. We'd also particularly like to hear about the importance of the rapid response roster to the work of the Africa CDC, especially when it comes to supporting outbreak control. Of course, as you know, this workshop is focused specifically on the research skills to support outbreak investigations and outbreak response. Over to you, Dr. Mohammed.
Thank you, Osman. My apologies from the previous meeting I had. My internet bandwidth was very poor, so if I put on my video, it will affect the quality of this audio. So I will remain with my video off. Let me say,
maybe you can send us a picture of you.
Yes, I will do that. And really, thank you, Osman, for the kind words. Let me say a very good afternoon, or is it morning or evening, wherever you are. And thank you for joining this extremely important workshop. So the globe has been faced with the COVID-19 pandemic for almost 2 years now. Globally, this pandemic has claimed nearly 5 million lives. 4% of these have been from the continent of Africa. And we know that the continent of Africa has served as a spot where quite a number of zoonotic infection jumping from animal source to human has occurred in the past decade. We've seen repeated infections with Ebola virus disease and now the COVID-19 pandemic. Let's not forget what happened in West Africa some time ago, nearly a decade ago, in which a lot of challenge to the health system occurred because of the outbreak with the Ebola virus disease. One Health, Africa CDC defines One Health as a transdisciplinary approach to making Africa safer and healthier for people, animal, plants, and their shared environment. One Health is important in Africa and globally because we are now seeing increased urbanization, especially in Africa, armed conflict, deforestation, globalization and ease of travel, climate change, all contributing to the increased risk of disease emergence or re-emergence from animal and spread to human. Even let's not forget the environmental and agricultural component. So in this regard, we've had outbreaks of COVID, Ebola, Marburg, and even rabies recently. The One Health approach is needed to address these shared health threats. And the One Health approach spread across zoonotic disease area, antimicrobial resistance, food safety, food security, taking care of extreme weather and conflict events that disrupt and displace population. Africa CDC recognized that zoonotic disease, food safety. How is Africa CDC supporting One Health on the continent? We have developed and implemented a framework for One Health practice where we're working in very close collaboration with the National Public Health Institute's division of Africa CDC to provide practical and evidence-based guidance for establishing One Health practice in these MPHIs and Ministry of Health that can be adapted to include any key stakeholders. Provide a set of minimal objectives, proposed activities to focus on One Health guidance to address priority zoonotic diseases and area of collaboration that needs to be strengthened with the other relevant sector and align with Africa CDC strategic plan, whether the old and or the new strategic plan that we are working with, and of course the tripartite zoonosis guidance. We are also focusing on strengthening multi-sectorial coordination and collaboration with key stakeholders, develop and strengthen coordinated surveillance systems and data sharing mechanism, strengthen laboratory systems and network to ensure early detection of priority zoonotic diseases, and ensuring effective coordination, coordinated public health emergency preparedness and response. So when Osman talked about the RRT, with Africa CDC have been right from the first day, actually, working on the Africa Volunteer Health Corps, learning from the experience of the outbreak and the response of the African Union in Ebola in the West African sub-region of the continent in 2014. So what we are doing is we're setting up this Volunteer Health Corps, a kind of roster, and this was given the backing by the head of state. And One Health component of that Volunteer Health Corps is very strong, including working with partners to ensure that we can, using the One Health approach, set up a rapid response team that can respond timely, effectively to any outbreak on the continent. And using that experience, when there is a pandemic, and it's when, it's not if there is a pandemic, we will have a critical mass of rapid response team we call Africa Volunteer Health Corps that will be able to respond instantaneously and save the continent. One of the lessons we've learned is that when there is a pandemic, the way the world responds means that Africa needs to look inwards and look within countries that are close to each other to be able to support each other. And that's why we are using the Regional Integrated Surveillance and Laboratory Network, which look at assets, public health assets within the country, within the region, before you go out of that. And that ReSNet has a very strong One Health component. And we are working very closely with different partners to ensure that this takes good care it's integrated into the public health response and pandemic response on the continent. Thank you, colleagues. Let me hand over back to Osman to continue. And greetings from the from Africa CDC and the director of Africa CDC. Back to you, Osman.
Thank you very much, Dr. Mohammed, for giving us that overview of Africa CDC's and the work in the One Health space, and of course their enduring commitment to the sort of One Health cross-sectoral approach and embedding equity and importance to all the different sectors, human, animal, and environmental sector as well within that. So that was really nice. That's a really nice way for us to dive straight into this next segment of the workshop. So we're going to be starting this session 3. It's going to be focused on One Health early warning and response systems tools. So again, taking the research angle on these and seeing how these can augment and support research activity in particular, and helping you think and conceptualize a little bit what are the types of research studies that can be done around this, what are the opportunities, and I hope you all do then set up networks of practice, both with Africa CDC colleagues, but also amongst yourselves across your countries and academic networks and your operational response networks to better inform and better enable response teams to leverage the opportunity to do research during outbreaks as well. So I'm pleased to introduce the chair for this session. We've got Dr. Laura Espinosa. She's an epidemic intelligence expert at the ECDC, European Center for Disease Prevention and Control. She's a public health veterinarian specialized in food safety, public health, and One Health. At the Complutense University of Madrid, I hope I pronounced that right, and University College Dublin. She has experience in epidemiology, microbiology, and preparedness and response of public health threats at national and international level. She's been involved in ECDC activities related to multi-country foodborne outbreaks in the European Union, the Zika epidemic in the Americas, Ebola virus disease outbreaks in West Africa, and the Democratic Republic of the Congo, amongst others. She's currently working in the epidemic intelligence team focused on the COVID-19 pandemic, as many of us are, and leading the digitalization of early detection of threats through epidemic intelligence activities at the ECDC. So I guess on the cutting edge of this stuff. So we're really pleased to have Laura join us as a chair. And over to you, Laura.